Hi guys, my name is Jessica and this is my flashcard presentation on hepatitis, including hepatitis A, B, and C. So the disease process. So hepatitis refers to the inflammation of the liver. It may be idiopathic, such as fatty liver disease, or result from a local infection, such as viral hepatitis, from an infection elsewhere in the body, such as infectious mononucleosis or amoebiasis, or from chemical or drug toxicity. While there are many different causes, the main focus of this flashcard will be on hepatitis A, B, and C, which are caused by viral properties. The pathophysiology. So this is a review of all hepatitis in general. Um, Although a number of viruses may affect the liver cells, hepatitis is considered to result from infection by a group of viruses that specifically target the hepatocytes. In this case, we are specifically discussing the hepatitis A virus, such as HAV, the hepatitis B virus, HBV, and the hepatitis C virus, HCV. The liver cells are damaged in two ways: by direct action of the virus, such as with Hep C, or via cell-mediated immune responses to the virus, such as Hep B. Cell injury results in inflammation and necrosis in the liver. Both the hepatocytes and the liver appear swollen, and diffuse necrosis may be present. Depending on the severity of the inflammation, the hepatic cells may regenerate, or fibrous scar tissue may form in the liver. This scar tissue often then obstructs the channels used for blood and bile flow, interfering with the unique organization of the liver lobule and leading to further damage from ischemia. Hep A. So the transmission of Hep A occurs via the fecal-oral route, which includes consumption of contaminated food or water and person-to-person contact. Outbreaks may occur in daycare centers, as well as sexual transmission has occurred in the homosexual population. HAV, or hepatitis A virus, has a relatively short incubation period of 2 to 6 weeks, and it causes an acute but self-limiting infection and does not have a carrier or chronic state. So it's only an acute state. Fecal shedding of the virus, or the contagious period, begins several weeks before the onset of signs. At this time, the first antibodies, IgM-HAV, appear, followed shortly by the second group of antibodies, IgG-HAV, which remain in the serum for years, providing immunity against further infection. Then we're going to move towards the hepatitis B. This form of hepatitis is caused by the hepatitis B virus, or the HBV, which is a partially double-stranded DNA virus transmitted by either blood or body fluids with an incubation period of 1 to 6 months. Often called a Dane particle, this virus is more complex and consists of 3 antigens: 2 core antigens, HBcAg and HBeAg, and 1 surface antigen, HBsAg, with each antigen stimulating antibody production in the body. This process leads to immune-mediated liver injury, as antigens are recognized by the immunological system, with a lesser effect from direct viral cytotoxicity. A carrier state is also common for HBV, in which the individual is asymptomatic but is contagious for the virus. Hepatitis C. This form is identified through the literature as the most common type of hepatitis transmitted by blood transfusions. This virus is a single-stranded RNA virus. Most people who acquire acute hepatitis C are unable to spontaneously clear the virus and develop a chronic hepatitis C infection, which considerably increases their risk for cirrhosis and thus hepatocellular carcinoma. Transmitted by blood and body fluids, and with an incubation period of 2 weeks to 6 months, this virus can also be included within the carrier state population. We're going to move on to risk factors and briefly state why it is a risk. So hepatitis A risk factors would be contaminated food, such as shellfish and water, due to infected fecal material being ingested. Daycare centers, due to the changing of diapers, and kids can touch poop and then smear it on other objects, and then another child may go up and touch that object and put their hand in their mouth. So that would be for hepatitis A. Hepatitis B and C, both are similar because they both are transmitted through blood and body fluids. Healthcare workers, due to the blood exposure, history of blood transfusions, IV drug or paraphernalia use, contaminated piercing instruments, sexual intercourse with an infected person, and organ transplantation from HPV positive donors. Major signs and symptoms, and briefly state how they are occurring. So hepatitis has 3 stages of symptomology. The initial stage is the pre-icteric stage, which leads to symptoms such as, their symptoms are of insidious onset with fatigue and malaise, anorexia and nausea, and general muscle aching. They may also sometimes have a fever, headache, a distaste for cigarettes, and mild right upper quadrant discomfort may be present, as well as serum levels of liver enzymes are elevated. The next stage is the icteric stage. This is the second stage and marks the onset of jaundice as serum bilirubin levels rise. Due to biliary obstruction, stools may become light in color, urine may become darker, and skin becomes pruritic. It may also indicate hepatomegaly, as well as blood clotting times may be prolonged, and this stage lasts longer with patients who have Hep B. The post-icteric stage is the third and final stage. This stage is shown by a marked reduction in signs and symptoms, although this period may extend over some weeks. Specific diagnostic testing for hepatitis would be specific serum markers identified here. The hepatitis A would be anti-HAV IgM and anti-HAV IgG. Hepatitis B would be HBsAg, anti-HBs, HBcAb IgM, HBcAb IgG, HBeAg, HBeAb. And then the hepatitis C diagnostic serum marker would be anti-HCV. And then you can further diagnostic tests would be radiological testing such as ultrasound or CAT scan just to identify that hepatomegaly is present, as well as CBC and CMP just to identify bilirubin markers and LFT levels. And then we are going to move on here. This is just a picture that I found of the structure of the hepatitis C virus. As you can see, it is a single-stranded RNA identified here. This would be the single-stranded RNA virus in the middle, and then it's encapsulated by the envelope, which is this blue part, the capsid, which is this gold structure, and then it also has E1 and E2 glycoproteins along the envelope. These balls right here, which help it attach. And then another picture that I just put in there is this chart. It does include hepatitis D and E as well, but I thought it was a good picture of hepatitis A, B, and C, and the sources of the virus, the route of transmission, the chronicity of the infection, and prevention exposures. And then these are my references. I hope you enjoy the presentation, and I wish you all well. Take care.